Hi, I'm Dr. Jason Tam. I'm an orthodontist at Markham Centre Orthodontics, located in Markham, Ontario, just outside of Toronto. I have a very special interest in the appliance Invisalign, and what I want to share with you today is the fact that I'm going to be starting my refinement aligners. Now, a lot of our patients have been asking me, what do the aligners look like, how do you talk with them, how do you put them in, what do they feel like the first time you're putting them. And so I figured it would be a good idea to actually record the closest thing to me starting treatment, which is my refinement aligners. As many of you know, I actually started the treatment last year, and I wore my aligners full-time, 22 hours a day as directed, and then I actually was very happy with where everything went. Looking at it a little bit more critically, I did see some areas where I wanted to have a couple of small rotations changed, and that's why I decided to go ahead with my refinement aligners. I didn't want to go into it right away at that time, and so I did wear my past aligners, the last set of them, as retainers at nighttime, every single night. So what I have here is my package of Invisalign refinement aligners. So as you can see here, it's actually my name right up there, and if you look a little bit further down, you can see in a little bit of a fuzzy package writing there my name, and I'm also the treating orthodontist. So what I'm going to do here is I'm actually going to show you that I'm going to open this package here for the first time, and you'll actually see me put the aligners on, you'll hear me talk with them, and you'll see what they look like. Okay, so I always talk to the patients about how the Invisalign aligners are a little bit of an adjustment. They do feel a little bit tight. You may develop a slight lisp for a couple of days, and it will feel like your teeth are slightly more slippery because they are coated with something like plastic. Do people notice them? The thing that I've been told most often during the first course of my treatment was that my teeth actually look shinier. Okay, so here's actually the top aligner that I've just taken right out of the package, and what I'm going to do is pop this in. If I do have a little bit of a lisp after I put it on, please excuse me, because this is something that is possible. Okay, so I'm going to go ahead and actually put this one in. Okay, so that's actually a little bit tight. And as you heard, there was a little bit of a snap noise at the back there. As you can tell, the aligners really do grip the teeth quite nicely. So anyone who is worried about the aligners actually coming off in your sleep or while you're talking, they do fit on quite tightly. We do have attachments as well that we do add on generally later on into the treatment to help grip the aligners a little bit better and to help correct certain rotations of the teeth. But again, they do fit quite snugly without that. What we are looking for is that the aligners actually line up right against the incisal edge of the tooth, or the biting surface of the tooth. Now, when you first start off with the aligner, this may not actually happen because the aligner is really how your teeth should be about 2 weeks from now. So it may not line up right then, but before I go ahead and change to my second aligner, I would want to make sure that everything is lined up nicely inside of that tray. Okay? One of the other tools that we use to help our patients actually make sure that they bite into the tray very snugly is we give them the aligner chewies. And I'll go into that a little bit later, but I'm going to go ahead and put the bottom aligner in as well. Okay, so I'm going to bite that a little bit better together, and now I actually do have the lower aligner, and again, that is slightly tight because I am expressing some movement of the teeth. Just wet my lips up a little bit there. I do have a little bit of an adjustment in how I'm speaking. There are certain sounds like the s sounds or the th sounds where I can actually feel a little bit of air going in between my teeth and the aligner, and this is because the aligners still are not snugly fit right up against my teeth. As I become more accustomed to it, and as the aligners actually get closer to my actual teeth, there should be less of a lisp that is expressed. Back to the aligner chewies. What we have been telling patients in our practice now with the aligner chewies is to actually go ahead and take the aligner chewy and bite on it for about 5 minutes every single night. What that does is it actually stimulates the area around the tooth, and what happens is that scientifically and biologically we know that tooth movement is generally expressed during the nighttime hours. So with that, we are trying to maximize the amount of movement that we get with the aligners. Okay, I'm actually going to have a sip of water. That's the only thing that I will actually have with my aligners in, so I'm going to actually take a swig of my water. Just wet up the aligners, get used to them, and probably go ahead and get ready for bed. Generally, I do tell our patients to go ahead and change their new aligners just before they go to sleep. That way any of the tightness or any of the discomfort associated with the tooth movement happens during the night and doesn't make you grumpy or feel bad during the day. Okay, well, I will update you on more of are the Invisalign that I am wearing. If you do want to see this video or any of the other entries or information about Invisalign, you can visit our main website at markhamortho.com. You may be watching this on YouTube, or you can look at our blog at markhamortho.blogspot.com. Again, I'm Dr. Jason Tam, the Markham and Greater Toronto Invisalign Orthodontist. I've just had my new aligners in, and have a good night.